Speaker, the President's latest SONA has confirmed that he has chosen the politics of his party over fixing the challenges of our country. His address was stitched together by slogans based on information that is out of touch and delivered for no one else besides ANC internal audience. Once again, the people of South Africa became a distant consideration for him. The President spoke about the enthusiasm of the proposed National Health Insurance Bill without giving the full context of the South African reality. Having been to some of the most forgotten parts of this country in the past months, the demand for quality health care has been made clear by Abantu Bethu. With every public hearing, in whichever town, South Africans told the horror experiences with the health system. This is because for the past 25 years, the health system has been shoddily patched up and carried by healthcare workers. This public process has revealed the lie which has been told to people who are desperate for change. It became evident that many had been sold a dream that the failures of the ANC government will be immediately rectified by the NHI. Yet we know that this is not true. Omama base Free State described the helplessness of waiting for an ambulance while loved ones were dying in their arms. They spoke of the fear of needing life-saving ARVs and being told, ayikho uzuphinda ubuye ngenye imini ngemali abangayazi iza kuvela phi. Otata base Freiburg articulated the limitation of facilities that have outdated infrastructure that can no longer accommodate those who use it. This immediately reminded me of the overcrowding that led to the death of 10 babies at Tembisa Hospital in a space of a couple of weeks. And the scar that will forever remind us that this government allowed for hundreds of mentally ill patients to die in the most undignified manner. Many victims of the nationwide oncology crisis are women from ezilalini ababhubha kabuhlungu yi-cervical cancer kuba kungekho ncedo. The waiting period in Limpopo alone is close to a year from diagnosis to treatment. There are cancer patients in this country who have been placed on a death waiting list while the ANC government is ngombis fuba ngenkonzo eziswe ebantwini. The very chairperson of the Health Portfolio Committee, Dr. Dlomo, would know this well, as this was the case during his tenure as a KZN MEC. We should never be mistaken. The people of South Africa know what they want. They want dignity and they want quality healthcare system. The most tragic though is how this governing party is using the NHI to mask the governance failures, promising an overnight transformation of the health system when they know that this is false. This government knows that this bill as it stands will not improve the quality of healthcare for people. It will not invest meaningfully in infrastructure for better clinics and hospitals. It will not ensure the filling of critical vacancies for nurses and doctors or fix the tendering system that leads to medication stockouts. This bill misdiagnoses the problem and will inevitably not supply the solution. South Africa needs universal health care, but it does not need the flawed NHI. The NHI is a poor and unaffordable funding model that will empower the politically connected, as we saw with the dubious appointment made by the health minister in his office. It will create another failing SOE, but still fail the millions who have been shortchanged by this government for the past 25 years.
Honourable Member, please take a seat. Honourable Mkhize.
Speaker, I'd like to rise on Rule 14S of the joint rule of debate and ask the member to withdraw the statement. They've made an allegation in the media. The media has actually withdrawn and retracted this particular statement. It is untrue and is misleading the House.
Honourable Mkhize, may I address you on that? Order. Honourable Mkhize, you rose yesterday on this point. I undertook to find out what the circumstances were. because I said to this House that I had not been in the chair and did not really know what you were referring to. I was going to rule on this matter towards the end of my sitting here, because as I was not in the chair, I was not really the right person to rule on this matter. Also, as that matter was raised, that matter should have been challenged when the Honorable Steenhuisen was still at the podium. I followed up on that and I looked at Hansard. In fact, Honorable Steenhuisen did not immediately leave the podium. He had a few more things to say before. And it is then that, looking at the ambience in the House, the levels of noise, looking at the circumstances which might have not enabled the Honorable Minister to make this intervention that I was looking for. And I couldn't find that. I am not the right person to be ruling on this. I am not going to rule on this. But I would say to this House, honorable members, when a point of disinformation or a point you do not agree with is raised, immediately rise in the House. If you do not do that, then approach us to investigate in a deeper manner, but not to expect that anybody who has not been here will be able to deal with that. The reason I disagreed yesterday when Honorable Steenhuisen was simply because I wanted to be clear that there was no impediment in the House that might have led to the minister not hearing and therefore responding quickly to what was said. Therefore, I cannot rule on this matter. And even now, as you raise it, the speaker on the podium is not the one who made that allegation, and therefore I cannot take that ruling when the speaker is on the podium. Please proceed.
Honourable Minister, I would be reluctant if I was you to really pursue
Honourable
this line
Gwarube,
of
take your
argument.
seat. Honourable Gwarube, take your seat. Honourable Minister.
With due respect, Madam Speaker, with due respect, I'm not rising on what the Honorable Steenhuisen said yesterday. That matter is with your office. I'm just objecting to what the current speaker is saying. That's what I'm talking about.
Point of order.
Okay. Honourable Minister. Honourable Gwarube, what did you say which... No. No, honourable members, please. No. Honourable Minister, you are objecting. You are saying the honourable member on the podium now has made a statement which she knows is not true and which was withdrawn in the media. I'm going to give you a chance to say exactly that so that we can put it to her. Now. Order. Order.
The honourable member refers to an appointment in the office of the minister of a relative. And I am saying she knows that that matter had been taken from the citizen who, after the matter was challenged with the media ombudsperson, the matter was withdrawn and that particular newspaper apologized. She cannot repeat it unless she comes to the speaker with a different set of facts, because she issued the statement herself. But she's not acknowledged the fact that the same statement that she commented on was in fact withdrawn by the newspaper. She wants to continue with it.
Point of order.
What's your point of order before I make a ruling, Honourable Mazoni?
Speaker, I rise on 14R read together with 14U. Now, I take extreme exception to what the Minister has just said, because the Honourable Member at the podium did not say anything of the nature in this particular speech. And if the
Honourable Mazoni, let me stop you just there. Honourable Member on the podium, you are quite competent to respond to the allegation put to you by the Honorable Minister.
Speaker, I have alleged that the problem in our public service and in our government is when members of the executive appoint politically connected individuals. I never mentioned anything about a relation. This is the problem. When ministers appoint their friends, their distant cousins, their
Honorable
aunts to
Gwarube,
positions.
Did you say the minister appointed somebody who is a niece?
I never said so, Speaker.
Honorable members, no. Don't help us. Sometimes you help us too much and then we can't function properly. Honorable Gwarube, I want to check Hansard before the end of this day and come back to rule on this one. On this one, I am chairing, I am quite competent to come back and rule on it. If you have made that allegation, Honorable Gwarube, you will be required to withdraw. Now continue with your statement.
I accept that, Speaker, as I have said that politically connected individuals have no place in political offices because they rob us of competent governments. In South Africa, most people have access to healthcare. However, it is shockingly poor. And part of these reasons is because we've got unqualified, politically connected people in positions. We cannot expect South Africans to wait any longer for the change that they deserve. At the same time, to place 58 million South Africans on a single NHI system without the investment needed will only lead to the collapse of the healthcare system. It is possible to improve the health system while reforming how it is funded. It is possible to recover the 22 billion rand that is lost to corruption annually. It is also possible to choose South Africans over politics. That is why the DA has brought solutions to the table. We have tabled the SONA Universal Healthcare Plan, which, if implemented, would address both the question of quality of healthcare and funding. This plan would ensure and would afford each and every person access to quality healthcare regardless of their economic status. Unlike the NHI, we would be able to guarantee quality because of the massive emphasis on investment to health. Mr. President, if you truly care about the plight of millions who rely on our health system, both public and private, lead your party back to the drawing board on this bill. Bring to the table opposition members, civil society, healthcare professionals, and abona abantu abasebenzisa inkonzo zempilo to craft a plan on how we improve healthcare, how we regulate the private sector to improve health outcomes, and how we ultimately rescue this ailing system. So as South Africa stumbles from one crisis to the next, we dare not fail them on their healthcare needs. Mr. President, on Thursday, when you respond to this debate, you have an opportunity to choose South Africans over factions in your own party. You can choose our people, and not as voting fodder, but as people who truly deserve better from you.
Thank you, ma'am. The Honorable Chitwe.